Okay, Dr. Pugh.
Good morning, everyone. Welcome to our town hall on COVID misinformation. I'm Lachelle Pugh. I'm the Research and Evaluation Director for the Northeast Ohio Black Health Coalition. The Northeast Ohio Black Health Coalition is a social justice organization, and our goal is to improve the health outcomes of African Americans in Northeast Ohio. Thank you for joining us this morning. We have with us Dr. Dale Block. He is the Chief Medical Officer for CareSource Insurance in the Ohio market. We have Reverend Reegis Bunch. He's the pastor of Fifth Christian Disciples Church here in Cleveland, Ohio. And we also have Chris and Elise from Drug Mart. Thank you all for joining us this morning. We're hoping to have a very lively and informative conversation on COVID misinformation. Dr. Block, I'd like to start with you. Can you explain to us, first of all, what is COVID-19? We want to do this for people who don't understand what it is and why it is important to be vaccinated.
COVID-19 is a virus, and viruses are pretty common in and around all of us. Might be able to think in terms of the flu or influenza is another type of virus. We know that the viruses can be controlled just through good sanitation and hygiene activities. We know that viruses can be worse in the winter time when we're all locked in close to one another, and a little bit less in the summertime. There are some viruses that we now have multiple vaccines for. COVID-19 is now one of those viruses that we actually have vaccines available to help our bodies deal with a viral infection. That is, I think, the big important issue is that we are able to manage viral illnesses with, again, hygiene activities and vaccinations. And COVID-19 is simply just another one of the viruses, often in the one where people can think of it being the common cold virus that is out there for us to manage, especially over the last couple of years.
So can you tell us, why are people of color disproportionately impacted by COVID-19?
Well, I think there's a lot of reasons. When we think about the social determinants of health, we have a preponderance of members that we care for that have CareSource insurance that struggle with making sure that they have adequate housing to protect them from the elements outside. Are they getting adequate food and food intake that actually helps us build a strong immune response in our bodies? What other stressors are going on in the community that actually work on lowering our body's ability to fight off viral infections? And I think that's, unfortunately, that's more of an issue with people of color and people of poverty. And I think one of the things that's really key when we try to understand how to do better in our communities from a health perspective is we need to look at everything through what I call the health equity lens, using cultural humility and empathy to really get to the root cause of what is, I think, leading members, especially in the African American communities, to get sick, if you will, more often, and have a much more difficult time than managing it from the reasons that I mentioned, and also, unfortunately, chronic disease, untreated hypertension, untreated diabetes, untreated mental health, an overabundance of behavioral health and substance use disorder issues. They all come together and they make up what our bodies need to do in order to stay healthy and well.
So could you talk a little bit about vaccination rates, COVID-19 vaccination rates for Cleveland or Northeast Ohio? Where are we at?
Well, from an all Medicaid plan, so there's 5 plans that manage Medicaid lives. There's only, at least last count, 2.8 million Ohioans that are covered under Medicaid as of right now today. We are seeing probably around a 48, 55% fully vaccinated rate. We have seen improvement in at least getting 1 vaccine initiated. One of the other things that we're seeing is when we are looking at kids, the 5 to 11-year-olds are doing pretty well when it comes to at least getting 1 vaccination. The 12 to 17-year-olds, that is our toughest age group to get even 1 vaccination. We're doing very well in the state as it relates to those over the age of 65. And in some cases, we see as high as a 70% fully vaccinated rate in that age group. Now, we're not only talking about just initiation of vaccines today, but now we're talking about boosters. And those boosters are given as a way to kind of perk up your immune system after it's had the first vaccine series to kind of go, you know what, my immunity to the virus is getting low. I need a little extra boost, and that little extra vaccine helps with that. The number of unboosted Ohioans, 50 and over, let's say, as of about 6 to 8 weeks ago, was somewhere around 26%. So all of the Medicaid plans have been working collaboratively now for almost a year and a half, looking at these numbers, looking at ways that we can best work collaboratively, not only amongst the healthcare systems, the federally qualified health centers, safety net clinics, but with our communities, our community-based organizations are great partners and have been great partners with us in order to get the word out that probably at least 1 vaccine is the beginning of developing additional immunity against a virus that is constantly changing. And now we have a new variant that's in the community called BA.2. The infection rates are going up, hospitalizations are going up again in other states. And we really need to remind everybody that we can't relax. We've seen the mask mandates start going away. People are not talking as much about social distancing, hand washing, and the like. We cannot rest on the fact that we saw the rates go down precipitously so that we could take off our masks, get closer, go out, be with each other. We have to continue to really close those gaps in vaccinations. And that's why, again, we're seeing the vaccination rates not what they need to be in order for everybody to be protected out in the community.
Why is there a disparity in vaccination rates for people of color?
I think a couple of things. One is, and this is the elephant in the room, right? Trusting our healthcare delivery system. We know that there's a long history where African-American communities have been mistreated by the healthcare delivery system. And I think when the pandemic started, everybody got a quick history lesson of what that was. It was unspoken, and many of us in the medical community helped bring that story out for everybody to hear, because it's important as to how we then need to improve on the way that we manage our people of color and poverty. And I think that the other thing that probably contributes is that there really isn't a true trusted advisor unless you've identified somebody in the community that you can have that face-to-face interaction with, even as we're doing now today, a Zoom call. So, really a mistreatment of African Americans in the healthcare delivery system over many years, and then not having that trusted community advisor availability when you have questions to reach out and go, I don't understand all this vaccine information. It's overwhelming. Things are happening. Help me understand it better so that I can make a good decision for me and my family on vaccinating against COVID virus.
Okay, so the Northeast Ohio Black Health Coalition, in response to low vaccination rates, especially in our African American communities, we started our vaccine clinics, and we partnered with Reverend Bunch and his church. So Reverend Bunch, I'd like to talk with you a moment. So your church played a role in our vaccine clinics. Why was it important for you to be involved?
Thank you for having me, Sister Lachelle. Thank you, Northeast Ohio Black Health Coalition, Longhaul. It's good to be here with these medical professionals. To answer the question why it was important, because we were in a state of emergency in regards to COVID, how it was harming our church members, harming our community. And thank God for the ministry and the life and the leadership and the vision of Yvanka Hall to plant this idea of a Northeast Ohio Black Health Coalition some time ago. I don't know if she knew, but she was, for such a time as this, we were able to respond readily and immediately to the concerns around COVID in our community. And so without the Northeast Ohio Black Health Coalition, I would have been swimming out in a very large lake with no help. And so I was actually more blessed that you all existed so that we can be able to respond in a very powerful way.
So I'd like to ask Dr. Block a question, then we're going to come back to you, Pastor Bunch. Dr. Block, Longhaul Covid, can you talk a little bit about that?
Absolutely. So right away, Longhaul Covid is an actual illness. It is not a manufacturing of one's brain or psychology. It is the after effects of having had the virus and the infection and getting over it. We see similar patterns to other folks that have, you may be familiar with chronic fatigue syndrome, fibromyalgia, other symptom-related conditions that we know are real and have no real way to be treated other than treating symptoms, which sometimes doesn't even work for that. We don't know how long it will last. We know that some people have and experience a short-term secondary, problem with it, maybe 4 or 6 weeks at tops. I know of several of our members in the CareSource insurance family, as well as around the country. It's ongoing. They've had it, already now for 1.5 years. I see Ivanka raising her hand on that. And again, and I want to stress this because this is really important. It is real. It is not something that is not real. And to be told as a patient by the medical community that it's really nothing that they can do. It's not real. The symptoms should come and go. You need to take this seriously, and you need to work with medical providers that believe that they can at least help with reducing the intensity of those symptoms to allow us to get back to function. I have practiced family medicine for a little over 30 years. And I was one of the few many years ago that said chronic fatigue is real, fibromyalgia is real. I had patients that had post-polio syndrome, very similar to long-haul COVID. They're real, and we have to treat them as real. And I remind everybody who's listening, if you are not working with the provider and you have long-haul COVID, you need to find a new provider that is going to be there to help you, because it may be very mild, it could be very severe for a long period of time that you're going to need support. I'm a little passionate about that if you haven't figured that one out.
Thank you. And let me say, I've heard Ivanka talk about her long COVID symptoms for quite a while. And I have a family member who had COVID right after Christmas. And even after the initial illness, there have been a number of symptoms. I actually traveled with this family member to a COVID clinic where the doctor, after this full-blown examination, some of what he said was, well, it's only anecdotal, but vitamin C, vitamin C and zinc. So basically his response was, for most of the symptoms, there really isn't anything that they could do, but from what people have told, vitamin C and zinc will help. I mean, these are kinds of things I've heard for a long time, but yeah, it was just, we thought it was interesting just to hear that from the doctor. And the burning smell is,
it's phantom. It's the phantom
smell. But yeah, that seemed to be one of those symptoms. So Pastor Bunch,
Dr. Pugh, can I ask one thing?
Yes,
first?
absolutely.
So Pastor Bunch, when you talked about your response to this and the fact that we were there on the ground, for us, it was important for us to have partners that were there. And so Drug Mart immediately, as soon as we talked about the fact that we needed a vaccination partner that would be there with us, immediately said, we're going to be there with you all. And so for us, just having a partner in the community like Drug Mart that said, we're willing to help, was important. And so for us, we want to thank you all for your efforts to address this immediate concern, because I think a lot of times what happens is when we're on the other side of this, people sit in planning meetings and they say, well, we need to go have a meeting to plan about what we plan to do about this. And it's like, okay, well, people are hurting right now. So how do we do planning meetings when things are happening? And I think for us, because we are a smaller nonprofit, we were able to pivot and say, let's address this unique need right now. But for you all, for the church pastor bunch, trying to get your congregation to understand the gravity of this situation and that they also needed to pitch. Because remember, like that first clinic when I was like, look, y'all can't just be coming in here. Saying like, look, like this isn't just church every day, y'all. Like this is like, I understand that this is your church, but we need to borrow your church for a minute in order for your church to actually become the secondary place of healing. So your primary place is to heal the spirit. And so we wanted people to be there to heal the body, but not to make sure that people were not at risk. So how did your congregation take the fact that we had these folks that are now coming in and
Yeah.
basically running a clinic.
Yes. Yes. Well, the congregation took it beautifully. They didn't know that something like this could exist at the church. And I mean, we were blessed to have the Northeast Ohio Black Health Coalition in Cleveland. And I was just sitting here reflecting on our clinics. I was just brought to tears almost, because there was a systemic failure that happened in during the pandemic in regards to addressing COVID in the Black community. Trump and Biden may be a voice for the nation, but Yvanka Hall and the Northeast Ohio Black Health Coalition is a voice for Cleveland and Cuyahoga County and Black folks' health. And the first clinic, let's talk about that, right? Where Yvanka Hall came into the Lee Harvard area, right there, 141st and Benwood at Fifth Christian Church. And we may have started off with like 20 folks coming in, about 20 folks coming in, 30 folks coming in. And those folks went out and grabbed other people. And the numbers kept coming and the numbers kept climbing. But then we ran out of vaccines. And that lesson taught me that when it comes to health in the Black community, Northeast Ohio Black Health Coalition should not be a small nonprofit. This nonprofit literally saved lives. And the systemic failure was not really believing, trusting, and investing enough in to leaders like Yvanka Hall and the Northeast Ohio Black Health Coalition to help really vaccinate more folks in the Black community. And yes, there are those old hostilities between the Black community and health. There's no doubt. I heard all of the arguments. But one way to bring a sense of safety in the Black community in regards to this pandemic is to make small nonprofits like the Northeast Ohio Black Health Coalition large nonprofits, well-funded, well-supported during these pandemic times. Because the story needs to be told how the Northeast Ohio Black Health Coalition helped this government, this nation, when they had no sense of real connection with the Black community because of long hostilities, racism that's still prevalent. But because of the Northeast Ohio Black Health Coalition, we saved lives. Powerful, powerful impact in the community. So I just wanted to say that. I just felt like this was the moment to finally say that. Thank you.
Thank you. Okay, we can't hear you, Ivanka.
So on the other side was Drug Mart. So Drug Mart wasn't initial our partner. Because originally the first clinic we had 57 people that we vaccinated, and we still had like 35 more people that were out there, and we had to turn them away because we didn't have enough vaccinations. And so when I reached out, so one of our other partners said, I'm gonna see if Drug Mart is willing to help. And Drug Mart was Johnny on the spot, like, what do y'all need? We'll be there. And and if we have to go back to the store to get more vaccines, we will. So so Chris, tell us about why it was important for Drug Mart to step in.
Well, yeah, you had mentioned that you guys are a small nonprofit, local nonprofit, so that gives you the ability to pivot quickly and make changes compared to a huge nonprofit, which has to have meetings to plan meetings. And we're kind of the same way when it comes to pharmacies, where we're local, Ohio-based company, employee-owned, and we're able to pivot a little bit faster than some national companies as well. And then also that vested interest in the community, because that's, we employ Ohioans, we serve Ohioans. And so trying to kind of emphasize that, especially through this pandemic, and try to help wherever we can throughout the state of Ohio in all sorts of communities, whether that be communities on the east side, west side, Columbus, whether that be downtown Cleveland or suburbs or what have you. So when you called us, and I had the pleasure of actually working at one of those clinics with you, which was great. Like Pastor Bunch said, if I didn't say it then, I'll say it now. Thank you for what you did for that and continue to do. But just being out there and being able to provide that, because again, as the pastor said, the opportunity to save lives, we normally do that within our own four walls of our pharmacy. And in addition to having a bigger public impact when we have an opportunity to exit the store, we also get to connect with the communities. And then I think it's good for our employees as well to have that different avenue to practice healthcare and practice pharmacy. So yeah, it was a great experience and definitely something we would do again.
So I have another question for you, Chris. Why did you feel it was important to provide vaccinations?
Yeah, I think the number one reason for that, by and large, is to protect individuals against COVID for themselves. And then also every person that is protected from COVID with a vaccine is then that much less likely to spread the virus, which means they're protecting their neighbors and their communities as well. So I think Dr. Block earlier had mentioned that hygiene and hygiene practices are probably some of the best methods for preventing viral infection. But the number two is if the virus does, make it into your system, you're a lot more likely to have a successful outcome or a good outcome if your body's been exposed to it before in the form of a vaccine. And so as far as what pharmacy can do and us as medical professionals, providing that vaccine is one of the most impactful things that we can do in the face of this global pandemic. And so doing that in every form that comes across our desk is something that we want to pursue, whether that be, like I said, in our own establishments, in our own buildings, or out in the community in the form of these community clinics.
And for either you or Elise, can people still go to Drug Mart for vaccinations?
Yes, yeah, we're still doing them, and right now, maybe even more than we had been in the last few months, due to the approval of the second booster doses. We are having some interest in that, and so what people would do if they wanted to receive a vaccine from us in one of our stores would be to go to covid.discount-drugmart.com. And there you can register for an appointment and choose a time that's convenient for you, and then come in and get an appointment to get your vaccine. If you don't have access to a computer or to the internet, you can just pick up the phone and call your closest Drug Mart pharmacy, and they can help you get scheduled if that's not something that you can do on your own.
And Chris, we hope that we'll be able to work with the pastor again and offer our clinics back, as the weather changes, because we've had some kind of crazy weather patterns during our last few. So we've dealt with the rain, with the snow, a blizzard one Saturday, and so hopefully with the weather changing, we'll be able to have open up the clinic again and actually be able to have folks that are, on stations at different corners in a community to tell people that we have the vaccination clinic going on. So hopefully for next month, we'll be able to start back, because for us, that is very important to make sure that we have a place that people can walk to, that is right here in the community. Because, contrary to popular belief, we don't have a lot of community resources when it comes to, having drugstores that are available for people to walk to, or within, even in that community, like the community that we're doing the vaccination clinic in, there are no drugstores within 40 blocks. And so, when we talk about walkability, that the church was something that was very close by a bus transportation, walkable to that community that's right there. And so we want to make sure that we're continuing this partnership.
Yeah, but if I'm not working, I will be there to give vaccines. Of all the vaccine clinics I participated in over the last 2 years, I think yours was the only one that I left with lunch. So that's.
And we feed you. We feed people well.
Yeah.
Yes. Okay. So Reverend Bunch, we talked about long haulers. Okay, so this is people still feeling the effects long after they've had COVID. So do you have long haulers in your congregation? And what's been the impact?
The impact has been loss of taste of loss of taste, and for some folks, they're still experiencing the loss of smell. And now we have to answer this new question, or at least I do, as a pastor. How do I help you with that? And so, and this goes back to building out new infrastructure of like health within the congregation. That needs to be a necessary component of the church. The pandemic taught me as a pastor that the church needs a department of health, a department of wellness, a department of physical well-being. Because now we have congregants that are saying, well, since I'm still having this long-standing issues, I don't feel safe of coming back yet. I know you open the doors of the church, I know service is going back on, but I don't feel safe. And so now we have to think about having a permanent virtual sanctuary that is well manicured, that people can still get the information from the church and stay up to date about the church. That's building out a whole new system. And so so the impact has looked like building out new systems. And thank God to, again, Northeast Ohio Baptist Health Coalition, because I'm looking for you for the answers of how we help the folks in our community deal with these issues. And then we're gonna have to walk alongside them the entire way.
And so do you have a support system for them, or is that something that you are in need of? A way to support, so you are in need of a way to support your long haulers in your congregation?
Absolutely. I have a master's of divinity. I do not have a medical degree. So yeah, like I need to be thinking with health professionals. And thank God we may have one or two in our congregation that has helped us set up COVID protocols within the congregation. But however, there is still this issue that our folks are still suffering with this in their bodies. And I know they go to the doctor and deal with X, Y, and Z. So I need to figure out a way that says, here at Fifth Christian Church, here's how we can be a source of either it be information giving or a longstanding clinic or whatever. We just have to really build this out. Absolutely.
Lachelle,
Yes.
one of the questions I think was important to us about not only about long haulers but about COVID in general, and I think it's a question for everybody that's on the panel, is that now we like, for me, I've lost 65 friends. So 65 people that I know have died from COVID. And so we have a lot of people that are traumatized. They're either traumatized because they've had COVID, because they are a long hauler, or because they have experienced loss. So those are, like, we have people, we talk about this adverse childhood experiences when we talk about ACEs and how it impacts people from this whole experience around loss and grieving. But COVID is a whole nother layer to this. So you may have people now who are afraid to go into drugstores or into doctor's offices or into churches, um, because they have been impacted by COVID. So for me, because my family was impacted, for those who don't know, before the vaccine was available, 10 members of our family ended up with COVID because we had a visit. My grandmother who was 89 years old at the time, had COVID, ended up with COVID, and I was there caring for her every morning, as I do, now. Um, and so my older uncle, who was 67, he ended up with blood clots all over his body. And he actually had to have his arm amputated as a direct result of COVID. They were looking at his feet, but they were able to get the clots under control. But he had them everywhere. And it was just like one day, all of a sudden, he was working and he said, I have the worst pain in my arm. For my niece, who, you know, COVID caused a bowel obstruction and she had to have emergency surgery because of a blockage. One of my uncles also had issues around his muscles. Like all of a sudden, things that he had been able to lift up normally, he couldn't do it anymore. And as you see, I have this cough that comes and goes for the whole year. And I'm like in a jacket. I keep the heat on. I have a heater in front of me. I'm always cold. I have a time period of time in the day that I'm so cold. And then when I unthaw, I hurt. I'm like literally in pain. I also had that whole smell of smoke where you're just sitting there and it smells like somebody is just blowing cigarettes in your face. And so we have these people, including me, who are traumatized, and going out to do regular things isn't going to be so easy. And so for people who are going to church, so this is a way for you all to answer. So first, Pastor Butch, for people that are going to church, what's your response? For Dr. Block, for people who are hesitant about going to doctor's offices and clinics, what's your response? And then for Drug Mart, for people who need things from the drugstore or need to, and they're like scared to come in, because they're fearful, because now we have people that are in these places, some with mask on, some with mask off. Um, and it's causing discomfort, because people are not social distancing any longer. Like they're right up on you. Um, and like the rules have changed because we have people who are telling folks that COVID is over. And so, what is your response for people who are traumatized and people that are trying to get back into the swing of life, that are maybe wanting to go to church services like they talked about? A lot of people aren't going to church on Sunday because these things that are still going on. So so Pastor Bunch, Dr. Block, and then Chris and Alicia, Elise, um, your responses to those.
Yeah, and Sister Yvanka, sending my prayers to you, and my condolences, and also, praying for all types of God's healing for you and your family. You are a angel to the community, and so your health and well-being is really important to me and to this community. So we'll be praying for you on Sunday. Actually, I'll make sure we'll put you in our prayer list, and we lift you up. So to answer your question, our congregation, I tell our leadership team that everybody needs to be heard. Everybody needs to be heard, because this pandemic has emerged some new challenges. And so, yes, it may seem like our members are just complaining. Do not discredit them. We need to take what they have to say very seriously in order to build out this new church, because the pandemic is forcing us to think in these new ways. And so I tell our members, please complain, talk to us, let us know what it means to have church again. Or else, the alternative is the church will close and the church will ultimately die. That's actually other alternative if we do not listen. And so right now, we have what's called a public comment, or I call it public congregational moment during our board meetings to hear from congregants. It's a brand new thing so that we can hear from them. A lot of our sick and shut-in folks, they're saying they're just not coming back. Some folks, I tell them, unfortunately, you have these pre-existing conditions. I can only pray for you outside of your door of your home, things like that. But I tell folks that complain, talk to us. and we will listen. And then second of all, talk to your medical professionals. Make sure you're on a treatment plan. You actually have a plan in regards to how you are experiencing COVID. I think that's really most important, that the pastor can say and do. Thank you.
Dr. Block.
Well, a couple of things come to mind. One is, and I think this is really important. You have to feel comfortable that your primary care physician is someone that hears you, respects you, and wants to work with you. Too often, I think that patients make excuses for why they continue to see a doctor who they don't feel they're in touch with. I know that it's very challenging to start over sometimes with a new medical professional and have to begin at the beginning and work through your story. But more importantly now, I think than ever, is the importance of that doctor-patient relationship where there's mutual respect, and that they really are engaged with you, and certainly not the computer while you're in the exam room. I think the other thing too, for those that are afraid to come into the office, if you have the capabilities, you still can use telehealth for a visit. It is a wonderful way to continue to connect with your medical professionals. In fact, in those of you that are under the Medicaid plan, we've actually had an enhancement of that benefit, where you can even have a telehealth visit with your pharmacist. And Chris can speak to that as well. Now that pharmacists actually can have a Medicaid ID number and bill for it. Incredibly important for the healthcare team. If you want to wear a mask, wear a mask. And don't be embarrassed by it, and don't be belittled by it. I'm reminded, unfortunately, of a national news item watching the governor of Florida chastise high school students of color as to why they had a mask on. And that was traumatic, for those students when they were interviewed after that. I think the other thing that I'll kind of stop with, that I think is important, and I picked up this with Pastor Bunch, care goes where people live, grow, work, play. We have become way too accustomed to having patients, our members, feel they have to go to a doctor's office. We need to change that model. And one of the other things that I remind people is we need to produce health, not consume healthcare, over what I call the life course of an individual's personal journey through health. And that starts even before you're born and goes all the way to end of life and in between. And there are different parts of that life course that need a different attention in order for you to produce health. That's health protection, that's health promotion, health prevention, even preparedness. When we think about how unprepared we were when the pandemic started, nobody talked about it. We had a federal plan that got put on the shelf because this is not the last pandemic we're going to see. We will see more, and we need to be aware of that, and we need to plan for that. So I always remind everybody, let's try to focus on health and wellness, deal with chronic conditions, but from a different perspective. Let's help you learn how to eat better, how to exercise, how to not smoke, not overuse alcohol, other things that we know really contribute to disease that also, are probably 60% of all death-related conditions in the world. I am thrilled to hear that there's a calling for building out that infrastructure in the church and in the church family. And certainly more than happy to be a consultant on that when you start to get down and get into the nitty-gritty. Happy to do that.
Yeah, and in terms of, you know, speaking about trauma and folks that are maybe a little more hesitant to come out into public and how that impacts us and what we're doing about it. I think the first thing is we don't want to be the reason that someone feels uncomfortable coming out. So step one for us would be making sure that our stores are sanitized and cleaned on a regular basis so that at a minimum, we're not causing anybody to feel uncomfortable, or at least they're having that reassurance. But for some folks, depending on the level of trauma or the level of discomfort, that won't be enough. And for those folks, we have things that we're doing like Dr. Block mentioned, the ability to have conversations digitally or over the phone, or looking into different types of telemedicine opportunities. And then also from a more practical, you know, because we're not just a pharmacy, we're a general store and a local, you know, shop as well. And so providing things like curbside pickups and trying to grow that aspect of our business as well, so that that's available for our customers who want to continue to use us as not only a pharmacy, but a store, but maybe don't feel quite comfortable coming back into that public setting yet.
Sister Yvonka, may I add one thing after Chris?
Sure.
Okay. Chris, are you finished?
Yes, sir. It's all yours.
Okay. I think also one thing that our church is doing is getting political, right? What does it mean to extend demands around healthcare for our community politically? And one of those things is going to look like universal healthcare. That not having that is failing folks. It's making a lot of our congregants feel like, well, you know, Medicaid allows me to pay for some of these medications, but it won't allow me to pay for the rest. And now that Pfizer is becoming more and more close to being something to be sold, it's now becoming jumbled up with, do I have enough money to pay for these type of things? And so to avoid our congregation from asking the money question, one thing we're going to have to express as a community, what does it look like for our medication and our healthcare to come across a universal system? That's going to be great for the next pandemic. I'm not going to be naive to say that there's not going to be another one, but what I will say, it will prepare us for something down the road. But we are definitely getting more political in our understanding of healthcare as well. And also to say that in conjunction with our nurses, while we were forced to be at home, our nurses were still going to work every day. And a lot of them are now building up hostilities against the government. And what does it mean for them to be taken care of during a pandemic? And pastors have to, because they have nurses in their congregation too. And they come for prayer and they come, you know, pastor, I haven't seen my children, or I haven't had a day off work. This has been overwhelming. And then that question comes up, well, we need you at work. but how do we make a more more wellness system in regards to a pandemic? What does wellness look like for our healthcare workers while they're being pressured and pushed to be on the front lines over 24, 48, 72, who knows, months, a whole year on end? And so, yeah, we're definitely getting more political because it's definitely on the front of our community, but also how do we support our healthcare workers on the back end as well?
Okay. So I'd like us, well, we didn't mention the Northeast Ohio Black Health Coalition has a long hauler support group for people who had COVID, for people with long hauler, long haulers, for people who've experienced loss from COVID. And so that's Tuesday. Is it Tuesday evenings or Thursday?
The fourth Tuesday of the month at 5 p.m.
Fourth Tuesday of the month at 5 p.m. It's virtual. If you'd like information on our long hauler, or excuse me, on our COVID support groups, you can contact me, LPUGH at neobhc.org. All right. So we want to kind of switch the topic a little bit. So we talked about COVID, what COVID is. We talked about people's experiences with COVID. And we've talked about vaccinations and why they're important. Now we want to talk about mis and disinformation. So, and for everybody, for Dr. Block, for Chris and Elise, and even Pastor Bunch, what are some examples of mis and disinformation that are circulating, things that are going on in the community?
Well, I'll kick things off on that.
Okay.
So, I think the biggest one that gets the most conversation is that the COVID-19 vaccines are not safe.
Mm-hmm.
If you are not a medical professional and you are a layperson, I think it is very challenging to understand the science behind how vaccines were developed and work. But suffice to say that, they did and do go through a very rigorous process to get approved for use in the medical community. The United States is probably the most strict as it reviews, any type of pharmaceutical that is coming to market to be used for the general population. And from my perspective, as not only a physician, but a scientist in public health, it seems as though everyone thinks because the vaccines came to market so quickly that safety was not an issue, or safety was bypassed, or the science was bypassed. I will tell you that the COVID vaccination has been sitting on the shelves of researchers for many years now. Remember, it's the common cold virus. And it wasn't sexy, if you will, to develop a vaccine for the common cold virus. But when the virus actually became much more, severe in causing disease, the jumpstart was a lot of the research was already available to move vaccination, that process of approval along very quickly, which is why we were able to get an emergency use in about 3 months. So that's one of the big ones that I deal with probably the most, is when people say that the vaccine isn't safe. And I'll pause and let my colleagues add in some other misinformation that they've managed.
Yeah, along with Dr. Block's comments about it not being safe, another one that we sometimes have conversations with our patients about is that the vaccine is not effective. And that, I think, comes back to maybe how it was originally rolled out or how it was originally talked about when the Pfizer and Moderna vaccines, for example, originally came out. They were coming out with 90% effective rates. And I think partially because of how it was communicated and partially because of maybe just a misunderstanding of what that meant, a lot of folks maybe thought that that meant that 9 out of 10 people won't get COVID at all if they get this vaccine. when in reality, what it was really talking about was more so it was preventing serious illness, preventing hospitalizations and death. And so when people who were vaccinated had breakthrough cases, even if those cases were mild, because of some misunderstanding about what the vaccine is really supposed to do and what 90% effective really looks like, I think that some people maybe thought, had a little more doubt about its effectiveness. So, whereas in fact, it is very effective at preventing serious disease, preventing hospitalization and death, and in some studies, even preventing long COVID or somebody becoming a long hauler. And so trying to supply folks with the correct information so they feel more comfortable about not only its safety, but its effectiveness. And then another one I'll just speak generally about is that we hear a lot about, given our profession, is various off-label or unknown drugs that are used to treat COVID or prevent COVID. And like the top one that comes to mind is ivermectin, which is in humans, it's generally used as an anti-parasitic drug, and it's effective at that. And there was like some very kind of weak evidence at one point that said that maybe it's helpful in treating COVID as well. And it kind of turned into this phenomenon where folks were looking to medicate with that, and in some cases self-medicate, and in some cases even going as far as to take medication that is used to treat livestock and trying to dose it themselves to use on their own person to treat COVID, and occasionally to disastrous effect where it would actually cause this whole host of other problems that they would need medical treatment for because they use this medication incorrectly. So all that to say, generally speaking, the best advice when somebody hears something about a medication or some kind of treatment is to always talk to their healthcare professional, whether that be their pharmacist or their doctor, or just to get this straight and narrow and figure out exactly what the facts are on various treatments that they may have heard about through social media or online or some other medium.
So now I've heard a couple of different things. I've heard people say that I'm not going to take the vaccine until they get the kinks worked out. I've heard that multiple times from different people. If you could talk a little bit about that. And also, for those who believe that natural immunization is better than getting the vaccine.
Yeah, I guess I could start on that. So as far as the kinks getting worked out, the data that I always like to point to and the numbers that I always like to point to are the hospitalization and ICU and death rates between the vaccinated and non-vaccinated. So for example, I think the last time that I looked at it was maybe toward the end of 2021. So around the holidays last year. And at that time, I think, something like 9 out of 10 or 95% of ICU admissions were non-vaccinated individuals. And so to me, that's the kinks are worked out. It's not impossible to get vaccinated and then get really sick. It's not impossible, but the numbers pretty clearly point out that you're much, much more likely to get seriously ill if you're unvaccinated from COVID-19. So I think as far as that goes, with how many people have been vaccinated over the last 18 months, the kinks are pretty much worked out. So if that's somebody's hang up, I would point to those numbers and strongly encourage them to go get vaccinated. And then I'm sorry, Dr. Pugh, what was the second part of your question?
the second part, what was it?
Natural immunity.
Natural immunity. Yes, natural immunity is better than getting the vaccine.
Thank you. Dr. Block, do you want to speak to that one?
Sure. I think everybody can remember, at least some of us can, that when somebody in the neighborhood got chickenpox when we were kids, everybody went to play at that house to get chickenpox, right? Until we developed, right? Until we developed a vaccine that was effective and safe, so that you didn't get the chickenpox. Now, I'm also old enough to have been vaccinated against smallpox. You know, when you rely on natural immunity, it does work, but it has to, you know, be a very, very large number to provide safety for an entire community. That's what we call herd immunity. And so those that got COVID, many thought that they didn't need to be vaccinated because they had the illness and it generated enough safety for them to not get sick from the virus again. Well, we learned that that wasn't the case, and that many people that got COVID were at even more risk when they got it a second time for severe illness and death. So I think we have to be really careful how we use terms because it can mean many different things. And I think it's important that you know, our listeners today not be afraid to ask these questions, but to ask and say, if you got an explanation that it doesn't make sense to you, you don't understand it, it's too, you know, too much of medicalese, if you will, that you're not familiar with, stop the person you're asking the question to and have them make it simpler, especially if you're working with a doctor and you ask this question about natural immunity. I guarantee you we're going to probably get some answers that you may not understand. So don't be afraid to ask why 5 times. Once you get to the 5th time, you should hopefully understand it, because what that does is it forces the health professional that you might be asking to answer even in a simpler way, so that you can understand what to do to best protect yourself. So natural immunity comes up quite a bit. Let me share something that I've always used this, and it just strikes home. You know, everyone is entitled to their own opinion, but they're not entitled to their own facts. And so the facts are, you know, there. We have to accept that. And then you have to understand that there's different ways to interpret the facts. And you have to be comfortable, you know, with that, you know, way, that opinion. You may not like the opinion, but you want to be careful that they're not changing the facts. And, you know, the best way to get, you know, solid facts, again, is from a trusted advisor, your physician, your religious leader, your trusted community advisor, even, you know, hopefully, you know, you could go to some of the more easy to use websites like the CDC website, the Ohio Department of Health website. They have, you know, a lot of content in there that is very easy to get to and to read and understand, because they work really hard at making sure that everybody can read it and understand it, to kind of hopefully dispel opinion and keep the facts straight.
Can I say something, Lachelle, about that we saw a lot of and hear a lot of from our organization about mis and disinformation? We have a lot of rumors that are running rampant in the African American community around COVID. I mean, seriously. And that's because we have a lot of people who don't go to doctors. They listen to other people. If they take advice from the people at the bar, from the people at the club, from everybody but professionals. So we would get early on we had a bunch of people who had this rumor going on in the community that if you drank Jamaican rum, it could kill the coronavirus. Well, they were calling it Rona at the time because that's when I realized that we had created a nickname for it. And so instead of COVID, we were calling it
The
the
Rona.
Rona.
Some people are still calling it the Rona.
And so the Mexican Jamaican rum was one. And before my voice goes, I'm gonna let Lachelle do the other one was cigarette smoking. We had a whole bunch of people who were coming to us and saying, well, I smoke cigarettes in order for me to keep from getting COVID. So that was the second one. And then the other one was, what was the other one, Lachelle? Because we had three. It was Jamaican rum, the smoking of cigarettes. Oh, and taking vitamins. That taking vitamins would keep you from getting COVID. And I actually had a nurse tell me that a physician told her to take vitamins. So could you talk about those things? Because I think that because they are so ingrained in the psyche of people who are listening to it. Like at that time, we had a run literally on Jamaican rum. And if you went to the liquor stores, there was no Jamaican rum because people were buying it because somebody told them. And they had TikTok videos and all this other stuff about Jamaican rum and then these other elixirs that they were making in pots. Um, Different things we would take for colds when we were kids. And so all of the misinformation, it's important for us to talk about because we need to let people know that this is wrong, that these are lies and untruths, and that people are still taking this as a truth. There are still people that I cannot convince to get a vaccination. There are people who know when I tell them that I had COVID, they're like, "Well, you had COVID because you were sick in the first place."
Mm.
Like I cannot convince them that COVID is real. And there are people in my community that still think this every day. I'm sorry, but that's my.
It's very challenging to deal with um, misinformation, but I think again, it's how the conversation is delivered. If it's done in a condescending fashion, I can tell you that that certainly is not going to help. I think the other thing too is to not address the myth, because you can go down a rabbit hole very easily, as you can, imagine. I think again, keeping the facts straight, using your, in my case, using my professional authority appropriately, respectfully, as I call with cultural humility and empathy. It helps, I think, to get people to at least engage in that conversation. I also think too, and I'm going to go back to this, is that when we teach people how to produce health and not consume healthcare, we actually get to the situation where how could smoking be good for anything, right? It just defies logic. But if you in the African American community have to travel to get your medical care and travel long distances, you may not want to do that. And that's the other reason for bringing the care to where people are, where they work, where they live, where they play. And that's why the community-based organizations that all the Medicaid plans have been working with have been so important. That door-to-door, knocking. We have several stories from several of your colleagues in other cities how great it was that community members were coming out into the community to help answer questions, right? Pastor Bunch, I'm sure that when you had your service, that after the service, if you addressed issues related to COVID, people came up and thanked you for giving them the right story, the factual story, not an opinion. And that's what we struggle with. I mean, I struggled with that for 30 years practicing. You know, sometimes having to undo wrong facts takes a while.
Mhm. Okay. Let's see, I have. So I have some information that I would like to share right now. And so what I'm going to do, I want to share my screen briefly. So people find a lot of their information on social media. And they tend to share it without actually knowing if the information is factual. And so I have here, can you see my screen? Yes, okay. So here is a website. The website is thetruthcheck.org. And this is a website where people can go and be able to find ways to actually figure out if what they're looking at, if that information is factual or not. It gives a description of misinformation and disinformation, and it talks about simple things you can do as you look at information. Then, you know, questions to ask yourself: what is the source of this information? Should I really believe this information? And so, along with that, there's a truth check training. So here it says, know the facts, take the training, share the truth. Here's a link here where you can click to take the training. And this is I'm going to just show this very brief video. It's 20 seconds.
Look, I know you care, but not everything we share may be true. And that can affect the way we take care of our health. Learn how to truth check your timeline at thetruthcheck.org. The truth will set you free.
Okay, so this is a very useful resource that people can use to actually learn about how to figure out if it's misinformation. So I want to share that with you. I've got one other resource I'd like to share. Let me get that back. And this other resource, okay, I'm gonna have to stop sharing to pull the other resource up. So my other resource is here. Let me go back to share again. Give me one moment. Okay. So here is the other resource. This is a community toolkit for addressing health misinformation. And in here, it talks about different types of information. It asks who it's for. I mean, it's for people that will be sharing information with others, you know, medical professionals, community leaders, but it's a really good tool. It's a really good resource for the general public. Again, it gives you things to look for. It describes what health misinformation is. And the important issue here is health misinformation can be dangerous if used inappropriately. Okay, and people can die from doing things that they heard would help them. Smoking to prevent getting COVID is not helping, it is harming you. And you know, one of the goals of the Northeast Ohio Black Health Coalition is to improve the outcomes of our community. And so we're all about helping people get the correct information, the factual information, the information and the resources that are actually going to improve their health. Okay, so I've shared those resources. That toolkit is available online from the CDC website. Now, we have about 8 minutes left, and in our last minutes here, I want to make sure I've covered all the questions that I had. So do any of you have any final thoughts, final words? We've been checking Facebook. We did answer the questions that were posted on Facebook. So if we could start with Dr. Block, and give us, you know, what you want the takeaway from this event to be today.
Well, I think the most important thing is if you are eligible to get vaccinated, please do it. Even one vaccination, even just one, is going to help protect you. And I think sometimes after the first one, the second one follows, a booster will follow. The other thing is that we may be moving into what's called an endemic state. That means that we have, and we've seen it, decreasing infection, decreasing illness due to the virus. But that is for those that have been fully vaccinated and boosted. For those that have not, this virus will find you. It will find you somehow, and it will infect you, and your risk for severe illness and death is as high as it ever was, even, you know, during the actual pandemic. So we can't rest on the fact that the infection rates are going down, or there's a new variant, it doesn't seem to be as severe as others. At least get one vaccine in your system. That's my takeaway.
Okay. Drug Mart, Chris and Elise.
Yeah, I would echo Dr. Block's sentiment about getting vaccinated. I also think it's important to know the facts. Thank you, Dr. Pugh, for providing those resources. I'll have to go check out thetruthcheck.org when we get off this call, just to see what kind of information's there. That seems like pretty user-friendly and accessible resource that can help dispel some myths. So that's good. Mm-hmm. And if somebody doesn't want to go to that website or what have you, doesn't have access to it, then that, you know, another good option that we've already mentioned here today would be talking to a medical professional that you know and trust about some of the questions that you might have, or some of the things that you maybe had heard, so that they can address those things as well and help kind of set you on the right path. It's going to be good for, you know, your overall healthcare. I think Dr. Block, I don't know if that was your quote or if you got it from somewhere, but I really like that, helping people produce health and not just consuming healthcare. I think that's a much bigger topic that this COVID falls into, but I think that's a good goal for us all to have.
Absolutely. It's a mindset. It's a mindset. Pastor Bunch.
Yes. First, I want to say, Northeast Ohio Black Health Coalition, thank you for keeping this on our consciousness and not letting the COVID conversation like die off because it's not in the news every day. I want to thank Dr. Block and thank Drug Mart for being passionate, but also being on the front lines for the fight against COVID. And to folks, yes, get vaccinated if you're not vaccinated. try to have those courageous conversations with folks who are, full of misinformation. Try to find a loving way to say it to them. Try to connect with their humanness, so that they can understand that this is necessary not only for them, but for their community and for their loved ones. And then also another major takeaway is to see this cooperation and collaboration going on amongst community partners, because this is what is needed to address this pandemic and the next and the next. So it's good to see Dr. Block on. It's good to see Drug Mart on. It lets me know that we do have some type of fortified system that can show up. So this is awesome. Thank you.
And thank you all for being here. And I do want to say, at the beginning of the pandemic, I was one of those people that said, I'm not getting the vaccine. And I saw so many people getting sick and dying, and those that didn't die, ending up with just such severe illness that one day I just got up, went out and took the vaccine. Because no matter what my fears were, turning into a zombie, I hear that one a lot. I don't want to turn into a zombie. I didn't say that, but I may have had other fears of the unknown, not knowing. But no matter what those fears were, me dying was not a good solution. So I got the vaccine because I wanted to be alive to experience all that I still need to experience. And so, I just wanted to add that. And I also want to thank some of our partners. We'd like to thank you, Dr. Block. We'd like to thank you, Drug Mart. Thank you, Pastor Bunch. I also want to thank some of our other supporting partners, National Network of the Library of Medicines, and as well as the Center for Black Health and Equity. Want people to take the truth, go to thetruthcheck.org, take the truth check, and also seek out that toolkit, COVID misinformation toolkit.
And Dr. Pugh, we want to also thank our partners that we have for the clinic, past clinics and coming up clinics. The National Council of Negro Women, the Cuyahoga County section, the Western Reserve section, the Black Nurses Society, Metro Health, um, Clash, the Cleveland-led Advocates for Safe Housing, the Cuyahoga County Board of Health, RX Foundation, Backs on the Spot, which has been our partner, and that's how we met up with Dr. Block
Yes.
and Drug
Yes.
Mart, and also um, did I miss anybody? And also the Disciples of Christ. We want to definitely thank them for being our partner in our vaccination clinic. And that on Monday we have produced a documentary about 9 stories about COVID and the impact of COVID on the African American community. It's called Black COVID, the Rona, and it is sort of like it's called Black Love. It's a series on Netflix, but we have a documentary that we're releasing. I'm executive producer, so even through all of this, I have executive produced a documentary around COVID, and so there are stories, diverse stories in our community. From political leaders who had COVID and their families that were impacted, community members who run organizations, and then just personal stories from people who lost loved ones with COVID from all over Northeast Ohio. And on Monday at 5 o'clock, from 5 to 6:30 at our annual board meeting, which will be broadcast live on Facebook. Also, we're going to show the documentary, so it's an hour long. So we're going to have our annual meeting first for 30 minutes, and then we're going to go into the documentary. But for us, it's documenting the stories and being able to tell our stories and our truth, and then having medical professionals that are on there that are talking about why it's important for us to still be vigilant. COVID hasn't gone anywhere. And I think that that's one of the things that when we don't hear it in the news, we think that it has gone away and that people aren't getting COVID any longer. Oh, like COVID doesn't exist. But as you've heard from all of our panelists today, um, and from Dr. Pugh, is that COVID is real and it's here. And it is so important for us to make sure that we are vaccinated, and that we are boosted, and that we do everything that we can to protect ourselves and our loved ones. And Dr. Pugh, I'm handing it back over to you.
We want to thank all of our panelists. We really appreciate all that you do. And we're thankful that you could be here to offer your perspective and help us educate the community. We like to thank those who are watching, those who have joined us on this webinar, and those who are watching us live on Facebook. And so this live will be there. You can go back and watch it. If you missed the links, you can catch them as you watch it again. And I'm going to go back and watch it myself. I've participated, but I'm going to go back and watch it later because I want to see, is there anything I missed? I've enjoyed doing this, and I hope people take away the fact that they need to educate themselves about COVID and how to protect themselves, and they should get vaccinated and not believe everything that they read. Listen to the medical doctor. All right, that's it for me, and I think we've had a good session here.
Have a great day. Have a great weekend.